Hi everyone, I am Dr. Nicolle Martin, your double board certified family medicine and preventive medicine physician. I help busy professionals use preventive and integrative therapies to not only improve the symptoms of many illnesses, but to cure some illnesses and truly save lives. Through my programs, seminars, and books, you will get healthy and stay healthy. You can find me on all social media platforms at drnicollemd.com. That is DrNicollemD.com. So today I wanted to talk about COVID-19 and health disparities. I want to give you the basics. This is part one of a series of talks that we'll be having. So when we talk about health disparities, we must also talk about the social determinants of health. The social determinants of health are the conditions under which people are born, grow, live, work, and age. The factors that strongly influence a person's health include access to medical care, access to healthy foods, of which there are many food deserts and food insecurity in low-income and minority areas. Environment, which can include access to clean water and clean air, socioeconomic status, employment, and social support networks. So the social determinants of health are intricately tied to racism. Racism is not merely negative attitudes or treatment from one person to another. Racism has deep historical roots in American society, sustained through institutional policies and practices whereby people of color are routinely and systematically treated differently than whites. Examples of racism include harsh judgment and treatment, few choices, not being able to hail a cab, getting poor service in stores and restaurants, being untreated fairly at work, being treated unfairly by police and law enforcement, being followed around in stores because of racial stereotypes. You get the picture. We must be mindful of the poverty, the redlining, the gentrification, food deserts, environmental and institutional racism that lead to chronic diseases and underlying health conditions. Believe it or not, there is a biological fallout from living with racism and oppression. One can say that an underlying health condition that is not listed in a person of color's medical record is, wait for it, racism. Racism is not only a public health issue, it's a personal health issue. So racism causes chronic stress. Racism is a chronic health condition. The daily chronic stress and threats of racial discrimination creates a state of biological imbalance that leaves certain groups of people more susceptible to chronic disease. So when stressors like racism or disadvantages in socioeconomic status trigger the sympathetic nervous system, which controls our fight or flight responses, the behavior of our genes are altered and cortisol and epinephrine are produced. So this leads to a complex biochemical events that turn on genes, which may result in poor health outcomes. So African Americans may be vulnerable to COVID-19 because many suffer from underlying health conditions caused by racism, which are caused by chronic stress, including asthma, diabetes, high blood pressure, obesity. Racism and discrimination are chronic stressors that people of color have no control over. So chronic stress releases hormones, again, cortisol and epinephrine, which increase blood pressure, heart rate, which increases inflammation over time. Thus, the body is in a constant state of fight or flight response. Both have protective and damaging effects on the body, but in the short run, the fight or flight response is essential for adaptation and survival and serves to protect one from a health threat. Yet over a longer period of times, cortisol and epinephrine can cause inflammation and speed up disease processes. If someone feels under threat for long periods of time, his or her health may suffer significantly from chronic inflammation. For example, driving while black and the daily threat of worrying about being killed by police takes a toll on the health of Black lives locally and nationwide. So the tension of never really totally relaxing, of always being on guard, is disabling, actually. So the daily chronic stress of those threats lead to high blood pressure, diabetes, asthma, obesity, and even PTSD and other autoimmune diseases. So for many people in racial and ethnic minority groups, living conditions contribute to underlying health conditions and make it difficult to follow the steps to prevent getting sick with COVID-19 by, we recommend sheltering in place. We often have limited access to masks, etc., or to seek treatment if they do get sick. Many of the essential workers and service industry jobs, these high tech, these high touch professions are held by people of color. So these jobs include frontline workers, bus drivers, home healthcare workers, factory workers, etc. They're vulnerable because of underlying health conditions, and they're vulnerable because of increased risk of exposure. So they simply cannot stay home and shelter in place. And those that live in multi-generational households find it impossible to self-isolate. I want to share this with you. If you are having trouble linking the two, health disparities and COVID-19 and racism, I want you to watch this awesome documentary. It's called Unnatural Causes: Is Inequality Making Us Sick? You can go to unnaturalcauses.org. It is a 7-part documentary series that explores racial and social inequalities in health. So, the environment in which we live is a major determinant of our health and well-being. Clean air, water, soil, plants, food supplies, and even our community environment, which includes the social determinants of health, are essential for our personal health. We will continue to talk about the environment and try to answer the question, what is a healthy environment and how does it get under the skin? The environment's health effects on our health is complicated, but there are ways that we can prevent and reduce toxic exposure. Stay tuned as we examine disparities in care during the COVID-19 pandemic. Thank you so much for watching. Take care.